Hey there, can't believe it's almost midterms. I'm sure you guys are surprised as well. Time is flying. We're already well into the middle of our second term, winter term. So here are the drugs for quiz 14. We'll start with another alpha blocker like doxazosin from last week. This is alfuzacin or uroxetrol. It's an alpha 1 blocker. Not used a lot, but even though it's a top 200, it is for urinary disorders, incontinence, that sort of thing. Then we have nitroglycerin, a very common medication that people get when they have a heart attack. It's to help with chest pain, particularly for people who are high risk for having another heart attack or people who have semi-regular cardiac pain. Brand name is Nitrostat, and it is a sublingual tablet. It's stored in these little tiny brown glass vials, and it's very important that patients keep them in those because they can degrade very quickly. And it's a class of a nitrate medication. Another nitrate is isosorbide mononitrate, or IMDR. It's a medication that's actually used more regularly for people who experience angina or cardiac chest pain on a more regular basis. Then we have fenofibrate, brand name is Tricor or Antara. This is a cholesterol medication lowering triglycerides primarily. And then we have gemfibrozil or Lopid, which is also a fibrate for lowering triglycerides. We have enoxaparin or Lovenox. This is a low molecular weight heparin, so it's basically a form of heparin that's used commonly in the hospital to thin blood. It can be used on an inpatient and outpatient setting. We dispense it pretty regularly in retail. It can actually be used to treat blood clots. It can be used to prevent blood clots. So we see it fairly regularly, and thank goodness it's a generic now because it's much less expensive, although still quite expensive. Then we have dalteparin or Fragmin, also a low molecular weight heparin. Don't see that really in retail at all these days. I would assume it's still used in the hospital, depending on drug contracts. Epogen or epoetin alpha is human erythropoietin. That is a red blood cell stimulating medication. And clopidogrel or Plavix is a blood thinner, antiplatelet, used very commonly for people with high risk of stroke or heart attack, most likely people who've already had one. Sometimes a lifetime drug, sometimes a short-term treatment after a first round heart attack. And last for this drug quiz is tizanidine or Xanaflex, which is a muscle relaxant, very popular in the retail setting. And that's it for this week. So good luck on your midterms. As always, contact me if you have any questions. All right.